Hello friends, 65-year-old woman has an intermittent 1-year history of sudden onset dyspnea and chest pain with tachycardia. 3 days before admission, her laboratory studies showed increased D-dimer with normal platelet count, prothrombin time and partial thromboplastin time. She suddenly dies and an autopsy is performed. Her left lung is shown in the figure. So this is the left lung which is shown here. If you see, there is black material which is an infarcted substance is present. This is a hemorrhagic infarct is seen. Here in this patient there is increased D-dimer with all pulmonary symptoms, that is it may be due to pulmonary embolism must have resulted in this infarct. So cause is pulmonary embolism leading to infarct formation. Explain the post-mortem laboratory findings. Here you have seen increased D-dimers because the thrombus has been undergone fibrinolysis in the body, which resulted in production of increased D-dimer. Why does she abruptly die? Maybe because she had a saddle embolism. Saddle emboli is something which is blocking the pulmonary artery outflow, which is a severe condition and it can completely block the arterial flow to the lungs, causing hypoxia leading to death. Thank you for watching.